Hello, my name is Dr. Paul Han. I'm a cosmetic physician based in Sydney. Here to talk about this revolutionary product called GOURI. I've been receiving lots of DMs about the GOURI because a lot of injectors all over the world wants to know how this is being injected, and they want to know my know-how because I've been doing so many cases in the last 3 years. So I decided to do share my know-how on the injecting technique of GOURI and how to maximize the result out of that 2 ml of that powerful collagen stimulator, which is available on our market at the moment. So just one other thing is before the procedure, we actually give our clients antihistamine 30 minutes before the procedure. So as you can see, doctor here is preparing a mixture of GOURI. There's actually a few ways of injecting it successfully and to get the best result. This is one of them. On the screen, the doctor is actually preparing a pre-lidocaine. So we get rid of the pain issues which we used to have the needle technique when we didn't have adequate anesthesia. So now the pains are all sorted because I normally give 0.3 to 0.5, so usually either 1-to-1 lidocaine with the adrenaline. Now there's so many variations of injecting GOURI. So all different countries, they use different techniques and different lines. I think these lines can be personalized and customized according to what the client wants. But in my clinic, the most popular one for full face neocollagenesis effect, because we want the thickening of the skin all over the face. So I want that 3 lines to cover the whole face. So for example, my most popular one is to do 3 lines in the lower face, but on this picture, on this video, we're doing 2 lines for the lower face and extra entry point up here for the forehead lines. Now, my general protocol is to do 3 lines this way because, these days a lot of your clients still do toxins to get your upper face wrinkles treated. So there's no real need to inject the GOURI on the forehead unless I have my client who's got a static line. I do that. And people who wanting a lifting result, eyebrow lifting result and rejuvenation on the forehead, I actually do the forehead lines. So now we're injecting a local anesthetic with the adrenaline. It's doing a very small bolus of a 0.1, but I actually I want to see the blanching from the adrenaline around 1 to 2 centimeter radius to the entry point. The reason being, I want to prevent any sort of bleeding. So the doctor is actually injecting 1/3 of a ml because we're using 1 ml per side. So doing a 1/3 of a ml per line. But just to make sure you inject the lidocaine on the same level, there's few techniques to stain the deep dermal. So with the GOURI, because it's liquid, we don't have to be precise with the depth. Theoretically, to get the best result, this material has to be injected into the deep dermal layer where all the fibroblast cells is there. But that's with existing products. So with the existing product, to get the best result, you do need to be precise. So as you can see, you can't even see the linear bolus, which you see with most of the other existing products. Because it's liquid, they spread out so quick and you don't even have to mold it. Usually molding with the high polymer collagen stimulators, they can cause overstimulation and cause swelling. So pressing and aggressive massaging is not recommended for collagen stimulators anyway. As you can see on the video, even if you're doing forehead line with the GOURI, the doctor's not worried about the intravascular obstruction at all. Doing a forehead with your HA fillers, you have to think about so much things. You have to think about the arterial blood supply because we don't want that in the blood system. As I said, GOURI doesn't cause blockage in the artery. We recommend to put you on a steroid for a few days to prevent any sort of swelling issues. I'm really happy with this product. And these are my tips over the years that I've been developing to safely inject and maximize the result at the same time. So I hope you learned a lot from this video, and hope you can inject GOURI very safely and use it long term. Thank you very much.